Honorable Ronnie W. Skelton, Minister of Health and Social Development, and the Minister responsible for Social Security, Dr. Kester Ned, Chairman and CEO of the Joint Independent Provider Association Network, Ms. Francesca Naves, Vice President of International Operation Caribbean and Latin America, Jipa Network, Ms. Victoria Kozolinsky, Executive Director of Jipa Network, Dr. Irad Potter, Chief Medical Officer, Mrs. Alice Pickering, representing Smith Peck Medical Center, Mr. Roy Barry, Deputy Director with responsibility for NHI, Mrs. Jeanette Boynes, Deputy Director Social Security, members of the NHI implementation team, members of the press, good morning. Good morning. Good morning. And lest I forget Mr. Cromwell Smith, member of the steering committee of NHI. A pleasant good day to all of you. I welcome you to this, another significant event in the implementation of the NHI, the signing of the contract between JIPA and the Social Security Board. This contract is for the provision of network administration to facilitate the easy access to state-of-the-art healthcare services in a timely and efficient manner. Much work, much research, and much deliberation took place for us to reach to this point where we are today. Other organizations which provide similar services were looked at, and we were convinced that JIPA would best serve the people of these islands. And so we are here to sign with them today. The scope of this network is far-reaching throughout the Caribbean, Central and South America, and the United States. The list of providers in this network is both extensive and impressive, and I'm certain Dr. Ned would speak to that in his remark. So we're here today to sign this contract, and the signing of this contract is further confirmation of government's commitment to providing access to healthcare, access to the best healthcare for the people of this territory. With that, at this time, we will have the signing of the contract at this time. Okay, the contract has been signed, and now we'll have some brief remarks by Mr. Roy Barry, the Deputy Director with direct responsibility for NHI.
Good morning, ladies and gentlemen. I will also accept the established protocol. We might all agree that medical services within the public and private sectors have grown in leaps and bounds throughout the years. We have witnessed the improvements to the new People's Hospital and the expansion of services offered by the BVI Health Services Authority. New services offered and improvements to facilities are also mirrored in the private sector. Even with these current developments, we still find ourselves and we continue to experience shortages in specialist healthcare services within the territory. This is by no means an indicator that we lack ingenuity or the ability to develop specialties medical services. Rather, it simply might not be cost-effective to offer some of these medical services within the territory. As the plans to bring the national health insurance system on stream progressed, we recognized that access to certain specialist health care would continue to pose challenges. To alleviate this shortage, we accepted that access to services overseas would be an essential component to supplement medical services not available within the territory. The National Health Insurance team has underscored the importance of adding access to an overseas network for emergency and non-emergency treatment. It is an element that might be considered essential to safeguarding the health and welfare of all registered beneficiaries of the program. This specifically might be the case in times when the medical service is not available within the territory, or when a covered beneficiary is traveling abroad and needs emergency medical treatment. The NHI team has been in discussion with several entities that offer regional and international access to specialist physicians and facilities. From the onset, the team was in communication with facilities in the areas most frequented by those who seek healthcare services off island. Some of these range from our Caribbean neighbors in the USVI, Puerto Rico, Trinidad and Barbados, and as far afield as Panama and the US mainland. The continuum of access in the case of medical emergencies whilst beneficiaries travel abroad is also of concern for the NHI. As we have recited many times during our public presentations, the team continued to progress its initiatives to solidify an overseas network for the National Health Insurance System. Today, we are pleased to confirm that an overseas network is now in fact in place. This morning's proceedings solidify the arrangements with Jipa Network, a limited liability company out of Miramar, Florida. Jipa will provide NHI beneficiaries with access to more than 300,000 physicians and facilities across the US mainland and the Caribbean region. The focus of the NHI is and will continue to be on providing our beneficiaries with access to excellent physicians and facilities within the territory and overseas. It is our mission to ensure that all beneficiaries are treated with the highest quality of healthcare when needed. Forging ahead with the contractual arrangement with JIPA is another testament to the commitment of the National Health Insurance Program to provide effective and efficient access to the benefits of the program. National Health Insurance, your security for a lifetime.
Thank you, Mr. Barry. I want to recognize the presence of Dr. Michelle Penn and Mrs. Penn from Penn Medical, and also Mr. Alred Fred from B&F Medical. At this time, I will turn the mic over to Dr. Kester Ned. Dr. Ned is the chairman and CEO of JIPA Network. So we'll ask him to make some remarks now.
Good morning, everyone. Honorable Minister Skelton, Mrs. Skelton, Mr. Roy Barry. I don't have all of the persons present and their names mentioned, so I would recognize the individuals who are connected with the Social Security and also the press and all others present. Certainly, I would like to also recognize the doctors present. And my team, Francesca Narvaez is in charge of Latin America and the Caribbean. She's the vice president for our organization. She hails from Bogota, Colombia. Victoria Kuzelinski, who is also executive in our management team in the JIPA network. A little bit about myself. I'm a practicing neurologist. I'm on the faculty at the University of Miami and also staff physician at Jackson Memorial Hospital. I've been involved in the care of patients internationally for the last 20 years. I used to be the medical director of Jackson International, so I had the benefit of overseeing catastrophic care for patients coming from the region and around the world to the United States, particularly in South Florida, for healthcare. And this gave us the impetus for building the JIPA network. The JIPA network consists of an association of medical providers that span from Latin America, Central South America, the Caribbean, and the USA. We do have an arrangement with the Aetna Network, who is what we call a wraparound network. They have well over 1 million providers that we work with. So in the areas where we don't have a provider, we utilize the Aetna Network for services. The way Jipa works, Jipa is based on physician-to-physician interaction. We believe that healthcare is a relationship between a doctor and a patient. Not a relationship between an insurance company and a patient, a hospital and a patient. Is a relationship between a physician. It's a very private experience, it's a private relationship. And contrary to popular beliefs, the marketplace in healthcare, because of the economic drivers that we see around us, we have lost the essence of communication between doctors and patients. And what Jipa Network sought to do was to develop an environment where doctors and patients could communicate with each other in a way that's sensible. What that does, it provides an opportunity for patients to get care in a way that it's reasonable, it's efficient, it's safe, and it's of high quality. In Jipa Network, we invite physicians to be members of the network by signing a contract. Also facilities, hospitals, we have pharmacies, medical equipment companies, any entity that provides services, including concierge providers like hotels, air ambulances, who participate in this network as providers. We utilize the collective bargaining strength of the group to refer patients within network. So most of the referrals actually come from another physician to another physician within the network, where we could actually communicate the actual information about the patient needs. We developed something called a care plan on each patient that's presented to us. Our medical directors review those plans, and from the network providers, hospitals, medical diagnostic providers, we're able to present that information and give the patient a chance to get access to the best care. We remain sensitive to the financial issues involved in the care of the patient. What we've been able to do is to actually create an environment that allows for lower cost healthcare by utilizing services where the most quality is. If you concentrate the volume of care into what we call centers of excellence, it allows you to get lower cost, because those institutions get enough volume that allows them to be able to develop a service of quality, such that they have enough technicians on board, they could maintain the equipment, or the services that they provide. This is a new model that's actually purported by the Harvard Business School. It's called the value chain in healthcare, where you look at healthcare from the perspective of value that you bring to the audience that you serve. We've been successful in developing this model in the Caribbean because of the tremendous need that exists. Our opinion is that healthcare has become now an economic opportunity for countries. Not only people that live in the Caribbean needing healthcare services, but expats want to come back home. Unfortunately, they have challenges finding access to not so much basic healthcare, but what we call catastrophic care. When you look at the size of a nation such as this, it's uneconomical to offer certain levels of services because of the cost and the amount of patients that you're able to care for. So our goal is to work with the local physicians and the local healthcare community to keep as much of the healthcare that should be offered on country and continuing to uplift the standard that you've already set here in healthcare. And for the ones that you're not able to provide care, to find an orderly manner in helping patients find access. The worst thing you could do in healthcare as a consumer is to go out on your own and shop for healthcare. It's not only costly from a financial standpoint, but it's costly from your health. I could tell you from personal experience the amount of patients that come through and access healthcare without going through a professional arrangements, the consequences they suffer in that they arrive late. And at the time they arrive, sometimes we don't have enough ability to prevent negative or bad outcome. So I applaud, first of all, your country in taking this brave step. I'm quite familiar with what the rest of the Caribbean is doing in this regard, and I think that you should be congratulated from the standpoint that you are taking a step that other Caribbean nations need to take, and some of them want to take but have not been able to do so. So I think you're setting a tremendous example by organizing this system. What we're offering here is a managed care environment. It's an environment where healthcare is managed in a way that allows people to access care in an orderly fashion. So I want to say thanks for the opportunity to serve. This opportunity is something that we've been actually doing for many years. I've been working with the physicians in this community and the hospitals in this community, been managing patients. And in fact, even currently, we have lots of patients in the Jipa system from the private side that have accessed us for health care. And in my opinion, and the comments we've had, they've all been well served. So this is not, this is just a relationship that we're now formalizing. It has been in existence for many years in terms of us providing this type of service. So we thank you for the opportunity, and I'll pass the mic on back to Ms. Skelton, and if there are any other questions or comments. Thank you.
Thank you, Dr. Ned. I refer to him as my minister. My minister, Honorable Ronnie Skelton, is committed to the success of NHI. And that's why he's here this morning. He could have been elsewhere. He had other commitment. But he's committed to NHI, and he wanted to render his support, to say to us at Social Security and the public his commitment to Social Security and to NHI. So he's here this morning not only as the minister, but he's so committed that he also signed the contract with us. So, Honorable Minister, your comments, please.
Thank you, Madam Chairperson. My namesake. Managing Director of Social Security Board, Mrs. Antoinette Skelton, Deputy Director responsible for the National Health Insurance, Mr. Roy Barry, Deputy Director, Ms. Janet Boyne-Scatliff, members of the National Health Insurance team, staff and members of the Ministry of Health, Dr. Potter, CEO of Jipa Network, Dr. Kester Ned, and members of the Jipa Network team, private providers, Dr. Penn and Mrs. Penn, Alfred Fred, Ms. Pickering, members of the media, everyone, good morning. It is with a great sense of accomplishment that I address you all on the occasion of another significant milestone towards the implementation of the National Health Insurance Program and the advancement of health care in the Virgin Islands. One of the greatest concerns of our people regarding our National Health Insurance Program is the availability of a wide variety of quality health care providers at home and abroad. Let the signing of this agreement today with the Jipa network of healthcare providers serve as reassurance to the residents of the territory that the government of the Virgin Islands, through the Ministry of Health and Social Development, is doing and will continue to do everything within its powers to make sure that all our people have equal access to quality health care regardless of their pre-existing conditions, age, gender, employment status, and from birth to death. Our National Health Insurance Program partnership with the Jipa Network will provide access to thousands of preferred healthcare providers, including those members in the Virgin Islands. And looking at the list, I see Eureka, Bougainvillea Clinic, Dr. Penn Medical Services, and I know Mr. Firth will sign on. This network consists of world-class clinicians, hospital, diagnostic facilities, and treatment centers around the world. In addition to access to thousands of providers, the Jipa NHI Alliance will also facilitate the coordination of patients' healthcare to reduce healthcare costs and promote access, enhance quality, efficiency, safety, and patient satisfaction. Ladies and gentlemen, this is a related day for the provision of healthcare for the people of these Virgin Islands, with the continued enhancement of our healthcare financing mechanism that is but one component of our national health strategy towards a healthier Virgin Islands. I take this opportunity to thank Dr. Kestened and his Jipa team for their ongoing commitment to making our national health insurance program the best that it can be in the provision of the widest variety of affordable quality healthcare services for the people of the Virgin Islands. I am extremely pleased to see a number of our local healthcare partners here today. Pick Smith, again, Penn's Medical Services and Fritz, BNF, and I understand Dr. Vanterpool couldn't make it. I greatly appreciate your support for the success of the National Health Insurance System. I also thank the staff of the Social Security Board and the staff of the Ministry of Health and Social Development for their hard work in the implementation of the National Health Insurance Program. And a special thank you to the media for your continued assistance with getting the NHI information to the public. As you know, the registration process continues. Starting today, everyone is able to register. I am encouraging all the residents of the territory to register so that come January 4th, 2016, contributions can be made and benefits can be claimed. The National Health Insurance Team is always ready and able to answer any and all your questions. You can also take advantage of the fully functioning website, vinhi.org, or call the NHI at 494-3411 extension 406, or come into the office in the Joshua Smith Social Security building. Providing affordable access to quality health care to all the residents of these Virgin Islands remains this government's mission. Our commitment to this mission will never waver. May Jehovah continue to bless each and every one of us and bless these Virgin Islands. Thank you.
Thank you, Honorable Skelton. The website is vinhi.vg. .vg. At this time, we're going to, for the next few minutes, open it to the press to ask a few questions.
Melissa Edwards, BVI Platinum News. Minister, can you first just tell us what the cost of the contract and was it tendered?
Well, let me let the technician answer the question.
There is no upfront cost. The way the contract works is that when Jipa works for us and the saving that we realize, because like he said, it's expensive, so the saving we realize that a percentage of that. And we anticipate that when we refer somebody for service that the cost saving is going to be anywhere between 25 and 40%. Am I right with that? Those figures?
Actually, our savings are much higher than that. We have a savings between, well, it depends on which country we provide. Yeah. Because we do a collective bargaining arrangement for healthcare, in the United States, the price for healthcare is very, very high. So there's a lot of room for savings. So the more volume you bring to a facility is the lower discounts you get. So our services are not just provided for citizens in the Virgin Islands, but we provide throughout the region, the Caribbean, and a lot of Central and South America. So that actually allows for most savings. The savings in the United States are larger because the cost is higher. The savings, so you could achieve savings somewhere between, I'll say 30 and 60% of the bill charges when you offer care. And this is called a managed care type of system. In the Latin American and the Caribbean, the savings are less because the price of healthcare on the top side is less. So you'll see order of 20 to 40% savings.
The second part of your question, whether or not it was tendered, you heard the managing directors mention in her statement that they looked at different options, and based on the analysis, the Jipa network option was the better option. If it was tendered in a traditional sense, no.
It was not tendered in the traditional sense, but we had submission from quite a number of companies.
Good morning, Zan Lewis, ZBV Radio. As a follow-up, Minister, mention is made that other organizations were looked into. What are these organizations, and why the decision? What persuaded you to go along this way over the others?
Let me get the different providers first.
Okay. I don't know that I can list them off for you right now. I can give them to you, but I can't list them off to you. But what persuaded us? There were several things. One, the scope of Jipa's network. Two, there was no upfront fee. We didn't have to put out any money upfront. Some of them were asking for upfront fee. Thirdly, because of the persons in charge of the network, and in particular Dr. Ned and some of his team, because Dr. Ned, what we didn't say, like he said, he knows the Caribbean very well. Dr. Ned is one of us, and he knows us. And then fourthly, because of his experience of working with doctors in the BVI.
Can I shed some light on a more general? This process didn't just start yesterday. You know, I remember traveling to Panama, to the United States, having discussions with some providers. We're trying to remember their name, but I can't. But one of the things we had to do in order to start the process is to advance $500,000 into a fund. And as we sent patients and it's depleted, we had to build it up. So we did not want that kind of arrangement. So some companies are asking for that arrangement.
How many persons, the private owners here, have actually signed on? Have you gotten all the support needed? Or?
Well, you're seeing some of the best in here. Dr. Pick Smith, you have Dr. Penn, you said Bougainvillea Clinic. I think there was a listing of all the providers that are in the Jipa network, and these are in the network that I'm talking about. And I'm sure, I am almost positive that more will be added as we go along.
Minister, I just have to shift a little. The Private Insurers Association recently have been thrown around some figures, I'm sure you're aware, and they had refuted and challenged your 65%, the 65% that you claim that persons were not covered, residents. Can you, would you want to respond to that? You still hold to that? How did you arrive at that figure?
Not really, I don't want to respond to it. If you ask me if I want to, I don't want to.
No, but do you...
But let me answer the question. In 2006, we engaged the services of the University of the West Indies Economic Unit. They were here on the ground for months. They produced quite a number of reports. And based on the analysis that they presented to us, the percentage was 60-something percent. I wrong it to 65. So if you want its exact number, 65, probably 66. But I wrong it off. But the figure is not important to me. What is important, and the message that you should report, is that a large percentage of residents legally residing in the Virgin Islands that don't have health insurance. I think that's our driving force. What the private insurance companies are saying, they must say that. It is in their interest. I can't sit here and say that they're wrong. If I was over there, I probably would have done the same thing. But they're trying to prove a point that they now can provide what we are trying to provide. And we are saying to them that if you're going to provide it, why are we here? If they were providing health care for all the people, then there will be no need for us to be here.
Sir, Minister, just one. Why is government reluctant to release the studies, the several studies done on NHI? Because I know Dr. Theodore had indicated. That's
not true. I laid a number of the documents on the table of the House in the last administration.
Have all the studies been released public? Are all the studies public?
No, when you say all, what do you mean?
All the studies done on NHI.
No, there is one study that is being fine-tuned now that we started the process, which is the actual study. So as we get live data, we make it more current. So we don't want to release a document that is 2000 and I forgot what number it is, for the media to basically misinterpret every information in it. So we don't want to do that. So as soon as the other document, as soon as it's updated and come to light, we will release it.
You said one that's actually ongoing work is ongoing, but all the other documents are public. So there's
all
nothing,
the other documents.
the government is hiding nothing. There's nothing.
I don't think I want to hide anything, because I'll have to remember where I hide it. I tell you as it is. No hidden agenda.
Minister, you know the concerns are some of the concerns of the people as regards the NHI. You know that these concerns continue to rise. You also know that about the petition that has been signed. You know there are over 600 people have already signed up against the NHI. This has been signed today. You already made mention that come January 1st, it will be happening. So are you saying, sir, despite that these petitions are to come before the Premier very soon, despite there could be a judgment made by the Premier, so are you saying that there's no if or no buts, despite the feelings of the people, NHI will be from January 1st?
I don't think there was anything important in this country over the last 25, 30 years that ever happened that did not happen with this level of public input. The unknown is always questionable. We are saying to you that we have a large percentage of our people that needs insurance. And the best way to do it is the solidarity way, where everybody contribute in a smaller way than a private insurance, and you get the same level and more care for your dollars. It's not about, we are trying to build a healthcare system for our country. So it takes some time making difficult decisions. And this is one of them.
Sir, just one follow-up.
This is one of the decisions. So the petition will go to the Premier, yes.
And that's it?
I can't speak for the Premier. You asking me to?
Okay, we're going to take 2 more questions.
Okay, just one more. In relation to the contribution, the 7.5, I think it is, percent, has the regulation be gazetted, the regulations for NHI? So persons can, because you're hearing the 7.5% contribution.
It's 3.7.
No, I know, the overall.
Yeah, but when you say it like that, it makes it sound, so that's a negative message.
Okay.
It's only 3.75% you will have to pay.
No, I meant I was talking
And
about
Platinum will have
employer.
to Platinum will have to pay the other 3.75.
Okay, miss. Thank you. But yes, has it been gazetted?
Let me know. I can't say. I know it was prepared, and if I could confirm that later.
Last question.
Dr. Ned, you made mention that the whole issue, it will be a physician-to-physician conversation to determine the best for the patient. Where the patient comes in, for example, obviously it will be a physician-to-physician to determine who is the best to handle the case for the patient. Now, if you choose, for example, Mr. Fred's organization or a local organization, where does the patient comes in to determine, I do not want to go there, I want to go at this facility? Where does the patient comes in to determine where he or she wants to go?
That's actually a very good question. I'll say this to you. Healthcare is a very complicated subject. The decisions to access healthcare often has to do with the level of service needed, the disorder, the state of the patient's condition. There are times you have a condition and there may be one or two physicians or systems that could treat that patient. So if the patient says, okay, I want to go to New York, and there is only, I'm using that as an example, there is really not a specialist there that is capable of providing that service, but they may want to go to New York because a relative may live there. Okay, our job as physicians is to really sit with the patient and educate them. This is about a relationship. You really have to sit with the patient because oftentimes we make decisions because this is a life and death. Healthcare is about our existence, and it's give and take. The point I'm making about a physicians to physicians, when you really think about it, when you go see a doctor, you put your confidence in that doctor. And that doctor has a relationship with many other physicians that they have knowledge of that provide us certain services. I'm not saying that there couldn't be biases or issues there, but by and large, what we've done in Jipa Network is to create an environment where people feel safe. And we've vetted the physicians, vetted the providers, and the good thing about it, the patients also have rights. If they go and have a bad experience from a provider, they have an opportunity to provide a survey. And we have a quality control or utilization management component to our organization where we're able to get feedback and provide that feedback to the provider. And if that provider doesn't provide the care that, in our opinion, then we have a group in our organization that would meet and make a decision about whether we use that provider in the future. And that's some of the issues that we deal with. Because, again, it's a quality service you're trying to provide.
One question, please. Follow up and then we're going to wrap up. You said that you may be forwarded to a particular provider, right? And that patient may have a problem with that provider. You may have to investigate it, right? To look into it, right? But at the same time, the patient is dying. The patient is getting weaker. Right? Now, for you to go to that investigation to see what the patient is talking about, how are you going to deal with that when the patient is getting weak and weak and there's an emergency? And the patient says, I don't want to go there, but you insist you should go there.
Well, again, like I said, healthcare involves lots of risks. When the decision to go to a particular place is not just made by one person or entity. That's why you have an established relationships. So that's much better than not having a relationship, because when you get sick and you need an urgent access to healthcare, guess what? You need an urgent access to healthcare. And understand that the facilities on the other end are also concerned about the risk, because the patient may come and the cost may get beyond a certain situation, and that patient or that entity may not be able to meet the financial commitments. What we're doing here is creating pre-arranged situation so it gives you quick access to healthcare in an emergency. Our part of this equation is primarily to focus on the overseas care. But in as much as it affects the local patient, the physician, and the access, we will work with the locals here to make this happen.
Okay. Yes, you may.
Just for some clarity, Dr. Mayor. Your group is not limited to just Florida in the U.S.
We're, Jipa Network is primarily, most of our providers that have signed a contract with Jipa Network are Florida-based. We do have in Philadelphia, we have some in California and some others. But we have a contract with Aetna, which is First Health, that provides coverage throughout the United States. And in fact, a part of our contract also provides care throughout the world, wherever Aetna has facilities and services. It's called a wraparound network. So for example, if they come through our network and somebody calls and says the JIPA doesn't have a direct provider, then we will go to Aetna and we'll access their rates and so forth. What happens is, when you have a small network or a small group that you're dealing with, the larger the network is, the higher the cost. What you're looking for is to have all the services that you have provided. There are lots of providers around the world that provide the same service. And, you could pick from anyone you want, but if you have unmanaged health care, the cost becomes prohibitive. This organization wouldn't exist if everyone is allowed to just go everywhere for health care, because unregulated health care comes at a cost in terms of price. It comes at a cost in terms of risk. So the best way to manage this is within a network. Look, Medicare works in a network. This is one of the largest healthcare delivery systems in the world. All of the insurance companies, even the current insurance companies that you operate with now with private healthcare, all have limited, they provide access to healthcare in a way through a network. So it's not something that's foreign to the industry. But the good thing is that we have partnered with larger networks, larger than ourselves, to be able to give access to you. And by the way, we're not only doing this for the Virgin Islands, but we're doing this in Jamaica, we're doing this in Trinidad, in Panama, Colombia, Grenada, the Eastern Caribbean. We even do it sometimes for persons in the United States. I mean, we provide, what you have is you belong to a larger group. If you go out as a small group and try to access healthcare services, it'll be very difficult for you to pay for it. And also you spread your risk by joining the JIPA network, because when you have a catastrophic risk, you're buying from a lower cost pool than buying when you go out on the market and buy it yourself. So.
I just want to thank all of you for coming. I want to say a special thanks to my minister, Honorable Ronnie Skelton, the persons from JIPA, Social Security staff, and I want to thank the press for coming. I wish you well. Before I go, I think it's important to thank the medical providers, Dr. Penn, BNF, Dr. Smith, Dr. Smith-Pick, Mrs. Alice Pickwitt and her staff from Smith-Pick. It shows that they have an interest in providing quality health care for all of us. So I thank you and I wish you a pleasant day.